Hello, everyone. This is Stephanie Calderon with Workforce Solutions Capital Area. Today, I have the pleasure of interviewing Eric Olson, and he is with Babson Diagnostics. And I'm going to go ahead and interview him a little bit about his company and what he's doing to help out with COVID-19. So, Eric, would you like to introduce yourself?
Sure. Hi, Stephanie. Thank you for the opportunity. My name is Eric Olson, and I'm the CEO for Babson Diagnostics. And I chose to pursue a career in the biotechnology industry because my high school biology teacher was my favorite teacher of all. And that's probably the biggest reason. I went to school at MIT and I majored in biology. And I also went to graduate school at the University of Pennsylvania and majored in technology management. I've been with Babson Diagnostics for 3 years, which is since I founded the company. It's a startup company. And what I enjoy most about it is working in the diagnostics field because it's such a rare field that you get to do all sorts of aspects of science and engineering. We get to do biology, we get to do chemistry, we get to do medicine, we get to do electrical engineering and mechanical engineering and physics and math. We really get to work across so many different technical disciplines that it's a very fulfilling opportunity. It's also very important to be in a field where you can help people and make a positive difference.
Yeah, with all of those different avenues that you're able to do, you can help in so many different ways. So I can definitely see that giving back aspect. So I love that. Thank you for sharing that. So we're going to go ahead and jump in. We have 7 questions that we're going to ask Eric Olson about his company and a little bit about manufacturing. So I have 7 questions in front of me, and I'm going to go ahead and start with number 1. With that being is, what type of company is Babson Diagnostic? Can you share a little bit about a general overview and the history of your company, as well as the type of products that you produce and how long it's been in Austin where you guys were founded?
Sure. So we call ourselves a retail diagnostic blood testing company. What that means is that we're in the business of testing people's blood, but doing it in a way that makes it more convenient and more accessible by letting people go to a pharmacy or a grocery store to get a small amount of blood collected and then testing that blood back in a laboratory where we can produce high quality results. We've been in Austin for 3 years. The company was founded in Austin, but we moved here from New York. We were in New York at the time and deciding the best place to put this new company where the best opportunity was. And we did a city search. We went to many different cities. We spoke to many chambers of commerce and mayors and different people that were trying to get us to go to their state and their city. And we ended up choosing Austin for many reasons, including the amount of talent that's available in the city and in the state of Texas.
Awesome. Well, thank you so much for choosing Austin. I mean, there's always something going on here, and there is a lot of talent. It's a big, robust community here, and students are so eager to jump into a new company and help out. So thank you for sharing that. That's really fulfilling to hear that you guys actually did your research and you were going through cities and speaking with mayors. I think that's really cool. So the second question that I have is, what types of jobs are available at Babson Diagnostics? And if you can describe a little bit about those job duties and the tasks that they'll be asked to do. And if you're comfortable sharing, what is the average salary, education, and licenses or degrees that are required for those positions?
Well, there's a very wide range of different types of jobs that we have here at Babson. Many of them have to do with running our laboratory. So we have a high throughput clinical laboratory that processes blood samples. So we have laboratory technicians, we have lab managers, laboratory directors. We have a lot of scientists that work on developing the tests that we run in our laboratory. So that's a lot of chemistry work, a lot of biology work, and a lot of using the scientific method and applying your critical thinking and analytical skills.
Mm-hmm.
We have a research scientist, we have an office manager, and we have myself. We
Yes.
also employ a phlebotomy team. Phlebotomy is the art of withdrawing blood from somebody. So it's very important to have great phlebotomists. So it's a broad range of people from different backgrounds, and the salary ranges vary just as much. Some of the salaries are in the hundreds of thousands of dollars, and some of the salaries are in the 20, 30, 40 $1,000 ranges. And it really depends on the type of experience, the type of education, the type of skills that a person brings to the role.
Okay, so would you say an entry level would be the laboratory technician or the phlebotomist to get into your company, for a high school student to kind of get their foot in the door?
Yes, they would be. So for a high school student, phlebotomist is probably the entry point. Although I would say many phlebotomists do also have associate degrees and bachelor's degrees. Many of the other roles require bachelor's degrees or master's or PhDs.
Okay, awesome. Thank you for clarifying. And my third question is going to be, how has Babson Diagnostics production shifted since, I guess, the mid-March when COVID-19 actually hit Austin, Texas, because it became a huge public health concern here in Travis County. So has Babson Manufacturing done any new products or in the response of COVID-19?
Yes, we have. We did change what we were doing a lot. We think that COVID is a kind of situation that really requires everybody to jump in and do what they can do. But in diagnostics, companies do really have to make sure to stick to what they're good at doing. So when we looked at the different opportunities in COVID, we saw that assay development, building tests was one of the key capabilities that we had, and focusing on serum was the main skill set that we had here. That's the clear liquid in the blood as opposed to the cells. So we began in March developing COVID-19 serology tests, and these are tests that detect the presence or absence of antibodies to SARS-CoV-2 in the blood. And that's really important for understanding who has had the disease in the past and who may in the future have immunity to the disease. So it's one of the key technologies that we see enabling the society to get back to its normal state.
Right.
In our business, we work across a broad range of routine blood tests that you'd normally go to the doctor for, like a CBC or a CMP or a lipid panel or your vitamin D. These are all things that we had historically been focused on, but we're keeping all of that going and adding the COVID-19 serology to it, because we think that down the road, 6, 12 months from now, having serology tests on a routine basis might be a new pattern in the way that people get blood tests.
Right. Something that's more regular in turn. So is Babson supplying these COVID tests locally to hospitals and medical clinics, or are you guys supplying them nationally and worldwide?
Yeah, we a little bit of both. We're primarily locally focused. So when we produced our first reagents and began testing, we decided to prioritize the organizations that we thought had the greatest need. So we targeted healthcare organizations, frontline workers, social services, and also the retailers, specifically grocery stores and pharmacies, people that are keeping us going through this whole 2 months so far period, and we hope will keep us going beyond that. So we prioritized those types of workforces to make sure that they could get the testing that they needed. We're also using a lot of our tests for research purposes, because we're so early in understanding this disease. We think it's really important to make sure that the researchers that are uncovering what the immune response to COVID-19 is have all the resources that they need. We're primarily focusing on Austin and Central Texas. We do have several partners that are out of state, but the vast majority of what we're doing is here in town.
Okay, well, thank you. We appreciate you as Austinites. I'm born and raised in Austin, so I know I appreciate that, especially a company coming in with just 3 years into Austin, having so much love for the community. I think that's awesome. And I hope the research goes really great. With these new testings that you have you hired anybody for the supplying of it through the workforce, any kind of new employees with new skills?
Yes, we have. We have grown the team since COVID-19 came about.
Okay.
We've hired one. We're working on a second right now. Um, the team that we already have in place is already skilled in the art of making new diagnostic tests and running diagnostic tests at high throughput. So we were pretty well positioned, but there is increased demand and a lot more work to do.
Right.
We have hired an additional scientist. We're planning to hire another phlebotomist. We have a quality assurance position that's open, and we expect that we'll continue expanding.
Good, good. Okay, well, good. You guys hear it there. Definitely check out this website so that you guys can see what opportunities are available and see if that's something that you qualify and can contribute to. My next question is, with the guys with the hiring, looking for any specific talented workers in right now that you are in dire need of.
I think it's that same group. It's people that can do a great job collecting blood and running blood tests. That's the primary activity that we have going on. So it requires a lot of attention to detail. It requires a lot of focus. Requires great customer service and a great attitude. It requires a lot of teamwork because being in a startup company in a situation as volatile as the COVID-19 situation
Right.
just requires a lot of flexibility and creativity and teamwork to get along.
Wow. So I know a lot of the positions that you have open right now require a lot of hard skills, but all of those things that you just notated right there are a lot of soft skills that are definitely important for somebody coming into the company to get hired and get a job with employment with your company.
Mhm.
So awesome. And I actually just did a webinar that we aired last week saying about all the importance of soft skills. So that's really great to hear that from you and hear that you guys really appreciate and require that as well. So my last question for you is, does Babson see any new product innovations on the horizon as the result of pivoting, the COVID response?
Certainly, we think that as a result of COVID-19, there are many, many new avenues of research and new technologies that will be needed to fight the disease. It's a disease that we don't really understand too well at this early stage, and nobody understands how the disease is going to end. But we do anticipate that with the advent of vaccines and the ability to generate immunity to the disease, there's going to be a significant need for monitoring that immunity. So we do see a potential future where COVID-19 serology is something that is used routinely
Right.
as a way to monitor the way that vaccines are performing and when revaccination is needed. There are also significant needs to broaden the range of testing that gets done, and that means making these tests more and more accessible farther out into the community and just making them easy to access. So we think there are a lot of opportunities that COVID is creating in the diagnostics industry to make blood testing a better experience and to make it more accessible for everybody.
Yes, awesome. Wonderful. Thank you so much for your time and answering these questions for us. I know that you're going to be educating a bunch of high school students who are ready to enter the workforce, who have their phlebotomy certification, who are pursuing post-secondary education to get that associate's or to get that, bachelor's degree in whichever avenue that they choose. And this has helped them tremendously to kind of see the work that they can do if they're not ready to be absolutely frontline, if they want to be more in the back burner when researching and innovating, as well as helping people. So everyone, we're going to go ahead and link down our email if you have any questions and concerns about this and you want more information. We also will drop down some links of where you can get tested and where you can find some of these testings in your local area in Austin, Travis County area, as well as the website where you guys can look at any open employment opportunities with Babson Diagnostics. So thank you so much, Eric, for your time again. We really appreciate it and I appreciate this interview. Thank you.
All right. Thanks, Stephanie.